Hello and welcome to my presentation on tDCS and Major Depressive Disorder. Introduction. Major Depressive Disorder, it's very common, it's a very debilitating condition. It affects between 6 and 12% of the population and it's very difficult to treat with a high relapse rate. Transcranial direct current stimulation, or tDCS, is a non-invasive technique involving sending a current through the brain to try and aid in this disorder. Review and critical analysis of the literature. So Brunoni has conducted a meta-analysis of results of participants in randomized controlled trials. 6 studies were included in this meta-analysis. One issue with this meta-analysis is that all the studies vary in the scales used to measure depression and the application process of the tDCS equipment, and this can affect the results. Overall, however, TDS was shown to be more effective than placebo and showed a similar effect size to antidepressants. Shizawa conducted another meta-analysis and review. 7 studies were included, and very similar results were found to the first. Again, issues just came back to sample sizes and effect sizes. Physiological mechanisms of major depressive disorder. One mechanism is an imbalance in activity between the left and right hemispheres of the dorsolateral prefrontal cortex, with less activity in the left and more activity in the right. Left activity is thought to be involved with positive processing of stimuli. Right activity is said to be involved in negative processing and how much attention we pay to emotional judgment. There is amygdala differences with unmedicated depressed people showing decreased amygdala volume and medicated depressed people showing an increased amygdala volume. There is also smaller hippocampuses, which is associated with depression, and lower levels of BDNF, which is associated with neuroplasticity. Physiological mechanisms of tDCS. So when the electrodes are placed on the scalp and the current sent through, neurons near the anode become hypopolarized and neurons near the cathode become hyperpolarized. When the anode is placed over the left DLPFC and the cathode being placed usually on the right DLPFC, this is hypothesized to change that activity. So to increase activity in the left DLPFC and then try and reduce some of that activity in the right. Between 0.5 and 2 milliamps of current is usually used, and this is not enough to trigger action potentials directly. However, it just does make it easier for the brain to meet that threshold for action potential firing by itself. After tDCS is finished, the effects continue, these neuronal changes continue for some time. This suggests that actual physical structural changes in the neurons are taking place. Critique of tDCS for MDD. As previously mentioned, there's inconsistent application protocol. There's also comparatively few studies done which are usually just made up of small sample sizes, and there's some inconsistency in the results. tDCS is only addressing that imbalance hypothesis and doesn't actually address any of the changes in the amygdala or hippocampus. It also doesn't affect BDNF, so this suggests that tDCS is only part of the answer in curing MDD. However, tDCS is well tolerated and has few side effects. Directions for future research. So first up, greater number of studies with larger sample sizes, as well as research into optimal protocols of use. Some investigation into what to do during the tDCS treatment would be interesting, as well as looking at possible interactions between tDCS and medication. In conclusion, tDCS presents a promising avenue for future treatment of MDD. Most studies do show a significant improvement with tDCS compared to placebo. This is thought to happen because tDCS increases that left DLPFC activity and reduces the right. This is my reference slide. Thank you very much.